So this is a CNN article titled "A Man's Tattoo Left Doctors Debating Whether to Save His Life." And there you go. There's the picture of that tattoo. All right. So picture this. A man is admitted to the hospital, unconscious with a history of serious health problems and a high blood alcohol level. He has no identification, of course, right? And no family with him, of course, right? Those are the cases that are more difficult. On his chest, he has a tattoo: "Do not resuscitate." What would you do? Okay. It sounds like a worst case scenario question from a medical ethics course, but it really happened recently at a Florida hospital. A newly published study in the New England Journal of Medicine explored the ethical and medical conundrums the staff faced when presented with a 70-year-old patient whose denial of potentially life saving treatment was right there on his skin. All right, so at first, the doctors wanted to ignore it. Okay, that's reasonable. According to the study, authored by a team of medical professionals from the University of Miami, the doctors attending to the man didn't want to honor the tattoo because there was no way to be absolutely sure that's what the man wanted. That's true. That's true. That would be my first thoughts as well. We initially decided not to honor the tattoo, invoking the principle of not choosing an irreversible path when faced with uncertainty, the study said. The doctors chose to treat the patient with antibiotics and other life saving measures. However, they called in the hospital's ethics consultant who had a different opinion. Okay, that's interesting. So I would say that I agree with the doctor's first assessment, right? And the reason is this. Yes, it is important to respect patients' autonomy. Absolutely. If you want a DNR, okay, then we definitely should honor that. But you don't really know the context in which this person got the tattoo, right? Like you don't know. For instance, you don't know how long ago that tattoo was, right? The patient could have changed his mind since then. Maybe the patient became religious and now wants everything to be done, right? We don't know. Okay. The general concern, right, is that we don't know if this is really what the patient currently wants. And the more serious the consequence, the more dire the consequence, the more I have to be sure that this is the patient's true wishes. Okay. So I want to see why the hospital ethics consultant had a different opinion. Tattoos, while clearly administered with a patient's wishes, aren't legally binding and are usually considered too ambiguous to act upon. Yeah, that makes sense to me. The emergency responder may wonder, do the letters stand for "do not resuscitate" or Department of Natural Resources or someone's initials? Second, the tattoo may not result from a considered decision to forego resuscitation. Errors in interpretation may have life and death consequences, the Journal of General Internal Medicine article said. Yes, completely agree. Right? Errors in interpretation. In the case of the man in the Florida hospital, the facility's ethics consultant said the doctors should honor the tattoo. They suggested that it was most reasonable to infer that the tattoo expressed an authentic preference, that what might be seen as caution could also be seen as standing on ceremony, and that the law is sometimes not nimble enough to support patient-centered care and respect for patients' best interests, the study reads. There was also another development that supported the consultant's decision. The hospital's social work department located a copy of the man's Florida Department of Health out of hospital "do not resuscitate" order, which supported the request on his tattoo. Okay, well, that makes a difference, right? Like if you actually locate the DNR, well, then that makes the case more clear, right? But if you didn't have that, like before they found that DNR order, I would have sided on the doctors on this one. I would have disagreed with the clinical ethicist on call. All right, so the outcome. Ultimately, a "do not resuscitate" order was issued and the man died. Okay. The authors of the study said they were relieved to find his written DNR request. The initial confusion over the tattoo brought up a curious issue that has been debated in the medical community on several occasions. So, the main concern, again, is you don't really know the context in which that person got the tattoo. All right, let's take a look at this other article that I think is interesting. So, this article was published in the Journal of General Internal Medicine, and its title is "DNR Tattoos, a Cautionary Tale." And it basically outlines a similar case where there's a patient who had a DNR tattoo on his chest. Okay. But this one is a little different because the patient could actually communicate his wishes. All right. So this is what the abstract says. Upon reviewing his code status, he indicated that he would want resuscitative efforts initiated in the event of a cardiac or respiratory arrest. However, he did not want prolonged attempts at resuscitation. When asked why his tattoo conflicted with his wishes to be resuscitated, he explained that he had lost a bet playing poker with fellow ancillary hospital staffers while inebriated in his younger years. The loser had a tattoo DNR across his chest. His code status was subsequently documented correctly in his medical record with further explanation of his wishes. Despite his comorbidities, he was relatively active in his outside life and was medically stable during his time in the hospital. It was suggested that he considered tattoo removal to circumvent future confusion about his code status. He stated he didn't think anyone would take his tattoo seriously and declined tattoo removal. Well, I don't think it's wise to have DNR tattooed on your chest. Okay, so that's the tattoo right there. So this case indicates a difficulty of inferring a patient's wishes from a tattoo, right? This person just happened to lose a bet. I mean, who would have thought that that situation would have occurred? But it did, okay? And this person got lucky because he was awake enough to actually express his views and explain why he had the tattoo to begin with, right? So I think this is a cautionary tale. This should act as a cautionary tale that we should not directly honor and immediately honor people's DNR tattoos. All right, so the most important lesson to learn from these cases is make your wishes clear. Okay? Make your wishes clear. The clearer your wishes are, the less confusion there will be for the hospital, right? And there are a number of ways that you can do that. So first is to fill out an advance directive. Okay? That definitely helps, right? The second is to inform your surrogate what your wishes are. Your surrogate is the person who makes medical decisions on your behalf when you are unable to, okay? And the first job of the surrogate is to use substituted judgment. Now, substituted judgment means that they're supposed to tell the team what the patient would want, okay? And if they don't know what the patient would want, then they have to act according to the best interest standard, right? They have to decide what is good for the patient. And that is more debatable, okay? It's much easier for the team if you as the surrogate know what the patient's wishes are, because then you can use substituted judgment, okay? But, okay, that depends on you as the patient informing your surrogate what your wishes are, right? All right, so the other recommendation that I have is to name a healthcare power of attorney. Healthcare power of attorney, all right? So a healthcare power of attorney is a surrogate that you name. If you don't have a healthcare power of attorney, then depending on where you live, the hospital may use a list of people with a descending order of priority, okay? And that person who's at the top of the list may not be the person who you may want to make medical decisions on your behalf. So for instance, some people are still married to their spouses, even though they have separated, right? So if you don't trust or don't want your spouse to make medical decisions on your behalf, you should fill out a healthcare power of attorney, because oftentimes the hospitals will contact the patient's spouse, right? Because they generally rank pretty high on the list. So that's something to keep in mind, okay? All right. So again, make your wishes clear, okay? You can do that by filling out an advance directive. You can do that by informing your surrogate about what your wishes are so that your surrogate can use substituted judgment. And if you want somebody specific to be your surrogate, name somebody as your healthcare power of attorney. All right, so I hope you learned something interesting, and I'll see you all next time.